All right, so we'll start recording here. First of all, how's your family doing?
Well, there's a lot of stress for the reasons that I think you're aware. We're the subject of serious types of death threats and harassments. And the thing that bothers me most of all is the harassing of my children, because, through all of everybody's address and phone number and everything is on the internet, and they get harassing, threatening, sometimes obscene type of harassing. They know where they work, they threaten them and try and frighten them. And they're scattered throughout the country. And I mean, I just think that's such a cowardly thing to do, only because I'm giving a public health message, which they happen to disagree with. So
So your daughters get harassed a lot?
Yeah.
Wow. And Dr. Fauci, I know that, everyone's had kind of a personal story of how it's affected their family. Tell me how it's affected yours.
Well, it's affected us in that, I'm in a very unusual situation because part of the country is very favorably disposed to me and what I do, and trying to speak, clearly the truth based on data, based on science, and not on anything that, is conspiracy theory things, but pure science. So there are people who really feel that that's what they want to have, is clarity and discussions based purely on data and evidence that's real. And then because of the divisiveness in the country, there are those who somehow interpret that as something that is against what they stand for. Just the way we know we have politicization of wearing a mask. We should never have divisiveness on any political way interfere with what the best thing to do is from a public health standpoint. So on the one hand, I have people who think I'm terrific and wonderful. And then on the other hand, you have people that are threatening your life, harassing you and your wife and your children to the point where I have to have a security detail with me. That's preposterous that a public health person has to have a security detail. That's really unfortunate.
Yeah, and you just said you're a hero to some, and then to others, you're the villain. But I know you shared a story about your daughter's boyfriend's brother, right, who passed away from COVID, coronavirus complications.
My youngest daughter's boyfriend's brother was a young, healthy guy, strapping, healthy 32-year-old guy who was one of the unfortunate people who was an otherwise completely well, who had one of the serious complications and passed away. Yeah.
That must have had a profound impact on your daughter and you.
Of course. Yeah. Well, of course, my daughter was very sad about it. She knew this fellow well. There was, her boyfriend's brother. It was terrible.
Has it impacted anybody else in your family or any of your friends in that same way?
Not that close to home. Not that close to home. Yeah.
Yeah. I can't, we were just talking about this. What's your life like right now? You were just telling me all these meetings that you're in, and we were discussing kind of our own work schedules where we're constantly working, and you are in meetings all day long, and you just said, your day's just started and it's already, nighttime. What are your days like?
It's a bit surrealistic. Yeah, it's quite unreal and almost unimaginable. I really, without hyperbole, have not had a day off since January of 2020, mid-January, when we knew that things were going to start getting bad here. It's been literally, literally 24/7, 7 days a week. You know how intense it was in the spring when New York City was the epicenter, and then we had the resurgence in the summer, and now we're in another. And the idea of having to keep up with all the information, to analyze it, to do the science. And, when I do have a day job, my day job is running the National Institute of Allergy and Infectious Diseases, which, when you think about successes, we were the ones that played a major role in the development of the vaccines that are now being used very successfully with a 94 to 95% efficacy. So that in and of itself is quite time consuming. It's very gratifying. But then you have the public health issue working on the White House Coronavirus Task Force, also, quite amount of an investment of time, and then trying to do all the communicating that's necessary to get the plain facts and truth to the American public. So it really has been like a totally surreal year. I think maybe when I could take a deep breath, I'll think back on this and try and analyze with it. But it seems like a different planet, really.
What keeps you up at night?
Well, that's an interesting question you asked, Jan, because a decade ago, 2 decades ago, people used to ask me the question, what's your worst nightmare and what keeps you up at night? And my answer was really quite consistent. I would say it's a brand new viral disease that jumps species from an animal reservoir to a human, that's respiratory borne, that's highly efficient in going from person to person, and that has the capability of severe morbidity and mortality. And sure enough, that's what we've been living for the last year. So when you tell me what keeps me up at night is what we're going through right now, because this would have been, this is terrible. If you look at the numbers, I mean, the reason why this is such a confusing outbreak, because it isn't uniform among everybody. In other words, everybody gets really sick and a few people die. It's like no other infectious disease I've dealt with where, maybe 40% of the people who get infected, mostly young people, either don't get any symptoms at all or are very, very mild symptoms. And then you get people, the elderly, those who have underlying conditions, and we have a substantial proportion of the population has one or more of the underlying conditions that will give you a greater chance of getting a severe outcome. That's diabetes, hypertension, obesity, chronic lung disease, heart disease, people on chemotherapy for cancer or for autoimmune diseases. So even though most of the people do okay, there are enough susceptible people that we now have, at the last count, about 380,000 deaths. And we likely will get well over 400,000 by February. That's the worst this country has faced as an outbreak in 102 years since the pandemic of 1918. So it's sort of a dichotomy, Jan. On the one hand, some people say, well, it doesn't bother you. You just feel a little bit like you have a little bit of a cold and you're all right. Yeah, that's for some people. But a lot of people get seriously ill and die. And that's where the messaging gets difficult, because how do you convince the entire country to do the kinds of things that are public health measures to prevent infection, like uniform wearing of masks, keeping your distance, avoiding crowds in congregate settings, particularly indoors, and washing your hands? There are some people who blow that off and say, why do I need to do that? It's not going to bother me. But the fact is, you may get infected and not even know it because you don't have any symptoms, and then inadvertently infect someone else who will have a dire consequence. So it's not just about you. And I guess that calls upon the hopeful selflessness of people in the country to realize that by my not getting infected, I may be indirectly preventing someone else from getting infected. So by protecting myself, in actuality, I'm protecting other people. That's a message that is not easy to get across, particularly when people, are more self-centered than they need to be.
Well, we are in that kind of society, that's the world right now. And speaking of which, you were talking about the death toll. The global death toll has now surpassed 2 million. The CDC just released data projecting, and I'm making sure this is correct, Dr. Fauci, 90,000 deaths in the coming weeks. And now we have talk of this new variant. What are you seeing right now?
Well, there's a variant that is taken over as the dominant strain in the UK. There's another variant with a set of mutations in South Africa and another in Brazil. The one we know the most about is the one in the UK, which is associated with maybe a twofold increase in transmissibility. They say, the Brits, and they're good, they know what they're doing, they say that it doesn't, on a case-by-case basis, increase the virulence of the virus, namely make it more dangerous to you. But when you have that many more people getting infected, some of them are going to be in the hospital and some of them are going to die. So you're indirectly, as it were, increasing the deaths. You're not making the virus more serious, but you're getting more people infected. The real question that we now need to get the answer to is whether or not it has any impact on the efficacy of the vaccine. The Brits tell us that their isolate doesn't seem to, but we're going to examine that a lot more closely to make sure, to do it ourselves, to get the isolate and to test it against the sera of people who've been vaccinated.
What happens if you find out that the efficacy, then all of a sudden now that this particular variant can somehow not be protected by the current vaccines that we have available on the market? Yeah,
well, I doubt if there'll be an all or none. It might lessen a bit the efficacy. It would be unusual to completely shut it off. If it, in fact, even begins to lessen it, then you have to start thinking in terms of modifying the vaccine and getting people to come back maybe for another shot to get a boost against this particular isolate. That's what would likely be done. But I think we don't want to get ahead of ourselves. We certainly want to be prepared for that. But that's something that I think we want to make sure we get good scientific data before we decide that there's a need for that. One other thing, that the South African variant is a little bit more disturbing because it's changed enough that it might evade some of the monoclonal antibodies that people are getting in some form of therapy. So something, again, we have to keep our eye out on.
And what does that mean?
Well, a monoclonal antibody is one of the treatments that's used for people when they get infected. They passively transfer this protein that is an artificially made protein that is an antibody that is used to fight against the infection. That is one form of therapy. That's the therapy that President Trump got when he was at Walter Reed. Right. Some of the other people, I think Rudy Giuliani also got that. So that's what's called a therapy or a treatment. It looks like that is possibly, and we have to confirm it, may be one of the things that is going to be neutralized, as it were, or not as effective against these isolates. But these are things that people are working on right now.
Well, that's kind of scary though, right?
Well, I don't want to use the word scary. That means that you're going to have to get other antibodies if you want for treatment. Right.
All right. So, Dr. Fauci, what's going on with this vaccine rollout? So many cities say they're running out now. What happened?
No, I don't think they're running out. I mean, the
Mayor Bill de Blasio says he's going to run out next week. Is that true? Is he going to run out?
Well, that's a good question, because you got to look at the total amount that was contracted for the country. 100 million now, 100 million there, or whatever, between the different companies. That what they did is that they were probably very efficient in vaccinating the people that were in that category in the first group. They're going to get more. They ran out this cycle. The way the vaccine is being shipped and distributed, they don't give you all the vaccine you're ever going to need. They give it to you in installations. And I believe what New York is saying, we've already finished up with our first or second installation. We want more now because we're ready to go, which means that there is more demand than there is supply. And ultimately, there's going to be enough vaccine for everybody. But those who are efficient in getting the vaccine into the arms of people, there will be the impression and the reality that they could use more vaccine right now. It's differences in efficiency in getting it into people's arms.
Yeah, President-elect Biden says 100 million vaccinations in 100 days. Can he do it?
Yeah, I think that's quite feasible to be able to do that. If he implements all the things that has been planned. He gave a speech just a little while ago. In fact, I ran from that speech here to talk to you, and he outlined the plan about how he is going to get that 1 million per day or 100 million in the first 100 days. And I believe it's eminently doable. There always will turn out to be snags and little hiccups and potholes on the way. But in general, it's a sound plan. I think it's going to work.
All right, so I got to ask you this question about what happened in Norway. 23 people died in Norway within days of receiving their first
Yeah.
dose of the Pfizer vaccine. 13 of those deaths were all nursing home patients. And the doctors are saying right now it was all apparently related to side effects. They were probably pretty frail. So it caused enough concern for Norwegian officials to now say they are considering adjusting their vaccination instructions. Is that something that we could see also here in the United States?
No, Jim, what I think they're referring to is that they gave it to a very frail population in the nursing home. And if you look at the bottom of that press release, something like 400 people a month or whatever it is die anyway in nursing homes because many of them have advanced disease, they're elderly and they're frail. So they're trying to figure out that maybe a side effect like a fever or making you get all achy that wouldn't bother you and I might just get someone who's really very frail to get into difficulty. So I don't think you could extrapolate necessarily what happened in the nursing home to the general population, where getting a little fever or getting an ache for a couple of days is going to cause you anything that's permanent harm.
And I want to ask you this because a lot of people are wondering, once they get the vaccination and they receive both doses and it's taken effect, does that mean this is like a free pass, a kind of like get a jail card where they can go out and drop their own restrictions and start making physical contact with family and friends?
No, unfortunately, it's not going to be that way, because although we know that the vaccine is 94 to 95% efficacious in preventing symptomatic disease, what we don't know yet is whether it prevents you from getting asymptomatic infection. So it is conceivable that I get vaccinated. It definitely protects me from getting sick. But when I get exposed, I do get infected. I don't know it because I feel fine, and there's virus in my nasopharynx. I might then inadvertently, go someplace and say, hey, I've been vaccinated, I'm fine. And yet I might be shedding enough virus to infect someone else. And that's the reason why the recommendation to continue to wear a mask, for two reasons, but particularly to prevent virus that may be in your nasopharynx from infecting someone else. So you don't get a free pass, as it were. You should be happy that you're protected against disease, but you can't just say, forget it, no more public health measures, no more masks, no more distancing. You've got to continue. When we get the country to be 70 to 85% vaccinated, and we get this blanket or umbrella of herd immunity, so that the level of virus is so low in society that it's not really a threat to anybody, then we can start coming down on the stringency of the public health measures. Bottom line is that if you get vaccinated, you can't throw away the mask, because you still could be infected and conceivably infect others.
Well, it's interesting you bring that point up, because England's chief medical advisor said he thinks this virus will never go away. He said he thinks this virus is going to continue to change over time, as the disease has already shown signs of doing. So do you agree with that? Is this going to be like the flu?
We don't know that, Jan. We have to make that as a possibility. We've got to be prepared for that. We have to take all of those potential scenarios seriously and think about how we're going to prepare for it. Right now, we do not know that we're going to have to vaccinate every year or change the vaccine. Right now, we're fortunate enough to have a vaccine that is extremely efficacious for the strain that now is circulating in our own country. We may need to make modifications as new strains that are different come in. We don't know that yet, but we're going to be prepared for that.
All right, very quickly, the UN Secretary General said that the death toll has been made worse by the absence of a global coordinated effort. And he said that science has succeeded, solidarity has failed. So how do you solve this without some cooperation with the world now? How do you solve this global pandemic if there's not any coordination within the nations?
I don't have an easy answer for you, but I hope that when not only the leaders of countries, but the people in the country look at the stark numbers that we faced and say, maybe it's a good idea to pull together to end this. This can't be something that falls to the divisiveness that one has in our own society and maybe even globally. We've got to have what they call solidarity. That's a word they use a lot. To me, it's just, we're all in this together. So let's pull together to end it. Otherwise, we're not going to easily get out of this.
All right, very quickly, because I got to ask you, as the Biden administration prepares to take office, what advice are you offering to that administration and any lessons learned that they should keep in mind?
Well, there's several things. I don't want to go through everything that we've discussed, but I think one thing that I can repeat that I've said even before the Biden administration was apparent, and that is to have more cooperation and interaction between the federal government and the local states and cities, instead of just passing it off to the states and say, do what you need to do, and that's it. I think we need to get closer interaction, both cooperation, financial help for sure. There's got to be enough money to do the things that they need to do.
Like, what things do they need to do? I keep hearing that. Like, what do they need to do?
The vaccine distribution and implementation better. They've got to be able to do that. That may require things that we need to put into place.
Like, what kind of things? What specifically can they do?
Centers where you open up to get people vaccinated in a very efficient way, going out into the community to make sure that we have equity in the distribution, because some people who don't have access to the pharmacies or the places where or to a doctor's office that's going to give you a vaccine, you've got to make sure that people in this country have equal access to getting a vaccine that could be life-saving.
Yeah, it's got to be amazing to you to see some of the healthcare workers that refuse to get it. There's still so many people who refuse to get the vaccine. Does that surprise you?
Well, yeah, and that's the reason why we still have work to do to get out there and eliminate some of that hesitancy.